When it comes to the depression, the treatment of depression, the speed and the precision where the depression treatment comes into becomes important. What we're finding it with all the monoamines, when we were focusing on some of the symptoms of depression and using serotonin, norepinephrine, like SSRIs, SNRIs, we find that there's a delay in treatment. Now the field in psychiatry and psychopharmacology is moving from monoamines to neurocircuits, the brain circuits that are the new targets of our therapeutic interventions. So there's a shift in how we treat depression. In addition to these circuits, we are looking at glutamate, we are looking at GABA, and these are the two what we call neuroplasticity modulating agents. So instead of looking just only on serotonin, dopamine, and norepinephrine, so our focus has been more on glutamate and focus has been more on GABA. And serotonin, dopamine, antagonist and partial agonist have also been found to be effective, and we will look into some data on that, especially when it comes to difficult to treat depression. So recently we have been looking into some new mechanisms, some pathways, and some of the neurobiology into clinical practice. So the speed, the precision in identifying and targeting major depression has been important. What we know is that with our previous treatments, it generally takes 2, 4, 6 weeks sometimes to see the results. As we look into anhedonia, suicidality, sleep disturbances, fatigue as some of the symptoms, when we look at about 8 million adults with major depressive disorder, and then about 360 million adults worldwide live with a major depressive disorder. So speed matters, especially when we are looking at the dysfunction, when we are looking at suicidal thoughts. So median time to antidepressant response has been from 4 to 12 weeks, and only 30% of patients remit to the antidepressant treatment according to the STAR*D studies. So the treatments have not been very effective. And when we have a non-response to the treatment, and if you're using similar modalities, then the response is not there. So some of the things we are looking into is how to prevent the functional decline, how to prevent suicide, and how to improve quality of life. Thank you.